Hi, my name is Dr. Luisa Kimeli. I'd like to thank you for joining us for part 2 of our talk on social anxiety, where I'll be talking about the thoughts that are very common in social anxiety and that contribute to the maintenance of the problem, and also a way that we can look at things differently. So a nice reframe that is more realistic, as I'm sure you will agree. So one thought is it's not normal to feel the way that I feel. Others never feel this way. It can happen like someone is, walking into a party and it's like their hands are moist and they feel a little bit shaky or their mouth is dry. And they're like, everybody looks so relaxed. No one else, had a second thought about this. They just walked peacefully, gracefully, and it's not normal to feel the way that I feel. And if you will remember from part 1, 99% of people have experienced social anxiety in some situation. So you are not alone at all. And 40% of adults report that they're shy, like describe themselves as shy. So again, it's not, it's maybe something that people don't discuss as much. It's not like, hi, my name is, I'm shy and I was anxious coming to this party. But you're not alone. Another thought is, if this interaction goes well, that's entirely because the other person was skilled. They really put me at ease and I felt comfortable talking with them. So it was their doing, they're really skilled. If the interaction doesn't go as well, doesn't feel, the same flow, then it's because I'm not skilled and I'm really awkward and I don't know how to handle social situations. If you think about it, an interaction is 50-50 and you deserve some of the credit when it goes well and some of the credit when it goes less well, but so does the other person. And oftentimes, it's just a perception anyway. Like an interaction that you thought didn't go very well might have gone very well from the other person's perspective. So it's always, very subjective, but in terms of responsibility, you need to give yourself credit when credit is deserved, and see that you only have a part of the responsibility. Another thought that gets people in trouble is sort of this idea that, if I say something stupid or replace stupid for any other pejorative word, if I say something stupid, everyone will think, or even worse, they'll know, if I have low self-esteem, that I am stupid. And really, everyone, again, it's the same as, everyone has experienced social anxiety. Well, everyone has said something stupid. And probably, the older, the more stupid things they've said, just because there's been more opportunity. Point is, everyone. So it's universal, and not to be judgmental with yourself. And it doesn't mean anything about you, because a behavior is not an identity. You can be really smart. I'm sure that Einstein must have said stupid things. Social anxiety is really, something that happens. It's not who you are. And there's really, it's just a feeling when it happens, that you make a little gaffe and you think, for you, it feels like alarm bells are ringing and lights are coming on because you've said this, the wrong thing, or used the wrong word, or what have you. But that is not reality. And in fact, I've sometimes made the observation that it's like a little bit of a paradox that's going on, because if you feel socially anxious in a situation, it's like you feel kind of small, want to be invisible, like just, not say anything wrong, not do anything wrong. But then in parallel, it's almost like, this thing that you're going to do or say that's going to be wrong, like, you used the wrong word, or you said the wrong thing or didn't make sense, it's as if it's the center of someone's universe. People will notice, they'll remember it forever. Like an example is, the server at a restaurant says, enjoy your food, and you say, you too. It's not the brightest thing to say in that context, but he or she is not going to give it a second thought, and they're really thinking, okay, like, what did this other table want, and what do I need to bring there? Is the food ready? What am I going to do after my shift? Like, whatever you said is not in any way the center of their world. But on your side, you might leave and say, oh my God, I said that. How could I have said that? So you have to realize that, it's like, mirrors on cars, right? That the objects appear closer than they really are. Like, it's a similar thing here, where it's very small for somebody else, and it's just in your perception that it's much bigger. Another, frame that gets people in trouble is seeing every interaction as a performance. It's really like every social interaction is an evaluation of my worth as a human being. And it's really not. You want to be more specific than that. So, because in some cases it is a performance and there is an evaluation. So if you go, for instance, for an interview, you do need to perform, as in, be able to highlight your skills and how you contribute to the company and so forth. And you are evaluated for the fit. The interviewer is probably thinking, okay, does she have the competencies? How would she fit into this team, into the milieu or culture, whatever. But that's the point, though. They're not evaluating you. They're evaluating, the criteria for the job and how you'd fit into this particular job. And it might be in the end that you wouldn't. Doesn't mean anything wrong about you. It's very specific elements that they're looking at. And that can help to reduce the anxiety if you're able to recognize that, okay, yeah, it is an evaluation, but of this particular thing, it's not a global evaluation. Another thought that creates anxiety, or that's common with social anxiety, is that the key to likability, social success, is to have, all positive attributes, no negative attribute, and only a positive performance. And of course, that's not possible. But also, it's more than that. When they look at likability, people will like someone who is competent, who has, good positive attributes, but also some weaknesses or some peculiarities. All good makes you suspicious about someone in the end. It doesn't foster, trust, in the sense that the person and that they're approachable. So there has to be, a balance. But showing a little vulnerability is really, again, it's how trust is built. So you want to be likable? Well, be kind, and be human. Another thought that's very common is, there's something wrong with me. And that's a kind of a deep one. There's something wrong with me, something embarrassing, deficient, flawed, and it will be revealed in this interaction or in this social context. And it's usually around anxiety, appearance, character, social skills, around some of these areas. So it's like, people will just see it, and that's going to be terrible. But if you think about it, something's wrong with everyone. um, and you really want to embrace the imperfection. If you were to ask around people, your family, friends, work, just ask anyone, when are you anxious? People, if they're truthful, will tell you when they're anxious. And everyone has situations where they're anxious. If you were to ask people, your appearance, like, are there certain things that you would change, if you could? I mean, if you could, not with surgery, but, in sort of an abstract way, like, are there things that you're less happy about with yourself? People will tell you, they'll be able to name this, that. If you ask people about their character, like, what are some of your weaknesses? People will have a whole bunch of weaknesses. And the same with social skills. Everyone has situations or, yes, specific situations or people or circumstances where they do really well, and others where it's like, they're less skilled. Maybe they've had less practice. That's okay. So I think, the next time that you think there's something wrong with me, well, yeah, there probably is, because there's something wrong with everyone. And that's part of shared humanity. Now you can choose, though. I mean, are you going to focus on criticizing yourself for those things that you would change? Or are you going to focus on your strengths and things that you have, that you value, and that you think you can bring to this world? Now the choice is yours, though. But one will bring you more happiness and better social interactions. Another thought that's unhelpful is, others are critical, and they would be critical of me. No, 99% of the time, it's your own doing. If you think about it, you'll say something or do something, and then you'll be beating yourself up. But when is the last time that someone said, oh, I saw you at the party the other time, you sat on the couch way too much, you checked your phone, you're a weirdo, you really don't know how to behave at a party, you should never go to parties, you're really weird, and there's something terribly wrong with you. I'll bet you that has never happened. not even a tiny piece, not even a version of that. If it has happened, it was probably you, as someone who suffers from a social anxiety disorder, telling yourself that, but it was not somebody else. Another thought that is not quite accurate is that it's bad to experience and show symptoms of anxiety. Here, there's that's been shown over and over in research, there's a big discrepancy between how, in social anxiety, like how you perceive yourself based on your own physiology, like how you think you're projecting versus what others actually see. And a good way to test that out is to let yourself be anxious as you can be. Videotape yourself and then watch the video, or watch it with a friend. And what you'll see is that you can have your heart pumping, like it's coming out of your chest. You can have your feel like you're shaking like a leaf. You could there's you can have quite an intense physiological reaction, and a small portion of that will show, not like nowhere near how you think that it's showing. And in fact, they've done studies where they've also had someone, let's say, you take a picture of someone in a calm state, take a picture of someone when they're actually feeling anxious, and you can't really tell. So know where, people don't see what you feel. And even if they do, it's a tiny little bit, and then it's probably relatable. And based on the context, might be very appropriate as well. And some arousal is good. So try to use it to your advantage. So that's the Yerkes-Dodson curve that shows that your performance goes up with arousal up to a point, and then it starts to decrease. It's the Yerkes-Dodson inverted U shape curve. So you want some arousal. So try to use it productively. And another thought that I think is changing, because I think it's maybe changing a little bit in terms of society, like how we view things. Being an introvert is a good thing. It's as good as being an extrovert. It's just, people have blue eyes, people have brown eyes. It's variability in human characteristics, and there's strengths and weaknesses in each. So if you're an introvert, you're likely to be a careful thinker, conscientious, good observer. Like you look at how things work before you actually go in there and intervene or make changes. You tend to be deeply empathic, pro-social, considerate, respectful, omit needless words. And also introverts tend to be really good listeners, which is something to really be appreciated. So there's a lot of good. There's no, it's no better or worse than being an extrovert. And I think that can be important because sometimes people with a tendency towards social anxiety will put extroverts on a pedestal because they like everything just seems so easy for them, and then they put themselves down, and then it creates a power imbalance. So you want to make sure that you see that, okay, each has their strengths and their weaknesses, and there's a lot that you bring to the table as someone who may be more introverted. And another thought that really permeates, I think, throughout social anxiety, and especially social anxiety disorder, that's really important as a maintaining factor, is that idea that you can somehow read people's minds, that you can monitor their reaction, and you'll know what they think of you, if they're thinking positively of you or they're thinking negatively of you. Like you look for signs, any signs of disapproval, of negative evaluation, like you're really trying to interpret any kind of change. And if you think about it, just think of like the FBI or border agents or psychologists in the lab. It's like so much has been done to try to see how we can read people's minds, and we can't, right? Like we're really not good at it unless people tell us. We don't know what people think, and I'm sure you've had the experience in different ways where you thought somebody thought something and you were totally wrong. um, it's it's not possible to do, and yet it's really throughout the whole process of social anxiety that it's present. So there's the anticipatory processing, right? So like I'll be, it's going to be terrible at the party. I'll be sitting on the couch. People are going to think I'm a weirdo. I won't be able to join the group. If I do, they'll think that I'm interrupting. I won't know what to say. So there's this whole, both anticipating, all of the potential mistakes that I'm going to make, then how other people are going to think about that and how they're going to react to that, and so forth. Then there's clear biases during social interactions. I mean, they've done, like one of the standard, let's say, or old experiments is they had people give talks who were socially anxious versus not. And they had planned, sort of in the audience. So some people had the role of showing, interest, like smiling, nodding, like very specific behaviors. And other people had the task of doing behaviors that would show um, lack of interest, so like sleeping or rolling their eyes, like again, very specific behaviors. But what they showed is that the people who were socially anxious were really picking up on the negative evaluation cues and not on the positive cues. So strong bias during the social interactions or social events. And then there's clear biases after the event as well. When you're going over how it went, then you're also screening for any sign of potential negative evaluation or negative effect. So there's a bias all across, but if you're able to recognize that you don't know what people think unless they tell you, then you realize that all of it is really stories that you're making because you don't know. So how can you change your thoughts? I mean, I've already, presented the reframes for you, but really, I'm sure you have thoughts that are, specific to your own social anxiety. So what you want to do is, specify what's the worst possible scenario that could happen if you went to the party, or if you approach your boss with a, idea that you have. And then you want to ask yourself, like, how bad would it be really? And here we're not talking about, I would die of embarrassment, I would cry, I would, we're not talking about your subjective experience. We're talking, I mean, although you want to have compassion for yourself, I mean, that is painful, but we're talking more about, objectively what would happen. And then how likely would it be that this would happen? Because often, again, with social anxiety, there's sort of a magnification of the actual consequence. So it's like assigning a big consequence to something that's relatively small. So let's say that you've been working somewhere for 2 years, and you are going to not be able to answer some questions in one meeting. Like, no, you're not, the odds that this will change what your boss thinks of you based on, everything else that's known about you is not very big. And the likelihood that you will lose your job as a result is also not very big. So it's about, looking realistically, what are the odds? And then let's say that it did happen, because you're never sure. No one can ever tell you that, this unlikely thing will not happen. How would you cope? And so, once you've done this, you've in a way cut the anxiety. It's not this big ball anymore. It's this manageable, um, whatever scenario, like whatever you're afraid could happen, it's okay. So now you can go ahead and do what you want to do. And remember to give yourself compassion as well. I mean, it is difficult when you feel anxious about something and when you're fearful, to actually go and face it. Even trying to think about it differently is a challenge. You're working on patterns that might have been there for a long time. And so, talk to yourself like you would talk to someone that you really care about, and talk to yourself kindly, and encourage yourself. That's also very important. So thank you very much for having joined me for part 2. And I hope that you'll join me for the continuation, which is on behaviors. how to make changes in behavior to cope with social anxiety.